On our Health Watch this morning, we are taking a look at National Immunization Awareness Month. It's a great way to remind people of all ages about the importance of staying up to date on their vaccinations. Fox 61's Tim Lammers over in Studio 61 with more on what you need to know this morning. Hey, Tim.
Yes, good morning. Yeah, people all over the world, including the U.S., are still dying from vaccine-preventable diseases. That should not be happening. That's why getting vaccinated is so important. So happy to have me with right now, back on the show, Dr. Bhavna Sacheti, a pediatrician with ProHealth Physicians based out of South Windsor. Good to see you again, Doctor.
Thank you for having me.
Yes, glad to have the South Windsor connection.
That's
Turns
right.
out we've known each other for a while. I've known her sister. All right, first things first, Doctor. Let's talk about the vaccines that are recommended for both adults and children. What sort of rates are still a little lower than we would like to see them?
Yeah, so, depending on the age of your child, there are different vaccines that are recommended. There's a schedule that we follow to try to make sure that all children get the recommended and required vaccines before they start being in kindergarten and attend public school. So in Connecticut, there are, those vaccines are recommended and actually required. And so every time you come to one of the offices for a physical, your doctor will sit down with you and talk you through whatever your child needs at that moment and what's upcoming.
Yeah, I mean, if you've ever seen that vaccination schedule, it is kind of daunting to look at sometimes. It's great to have that doctor there to sort of guide you through so you don't have to worry about it so much. And I feel like we're in a great spot here the past 2 or 3 years with vaccine development, not just with the COVID vaccines. We're now seeing RSV vaccines and other kinds of treatments too.
It's true, and it's so exciting because we're really hoping that these things can help us to prevent serious disease and even death from diseases that are preventable with vaccination. And it is incredible that preventing those illnesses can help not just your child, but other children around them who might be having weakened immune systems. And so that immunity around the community is so important.
Yeah, it's a community benefit, which is why it's a community responsibility. Interesting question here that I wanted to ask you. Are there any specific recommendations for vaccinations, extra vaccinations for people based on either their travel habits or their lifestyles, things like that? Absolutely.
So, for people that travel to places where there are different diseases that are endemic, like yellow fever, for example. So there is a vaccine for yellow fever. It's not part of, the routine vaccinations around here, but certainly if you're traveling to one of those places, you should talk to your provider and they can help you to figure out where you can get one of those vaccines. For some patients with weakened immune systems or other health conditions, there are extra vaccines that people sometimes will need. Pregnant women get certain extra vaccinations. Healthcare workers like myself get extra vaccinations for different things so that we can continue to take care of people and work. And so those things are available.
Yes. And lastly, those back-to-school vaccinations. Is there like a timeline in which you need to sort of get it done? Because sometimes these vaccines, they take a few weeks to sort of take effect?
Yes. Generally, after you get a vaccine, the immunity takes about 2 weeks to develop. And so this is a perfect moment in the beginning of August before all the schools sort of set back in late August, early September. And so anything that might be due, this is a great time to kind of get in there and kind of contact your provider and just sort of make sure things are up to date.
Yeah. And as we were talking about before, we're starting to see vaccine rates in school-age children dip a little bit before the pandemic. It's starting to rebound a little bit, and that is a good sign because, as you were saying, we're seeing little pockets of diseases that we shouldn't be seeing.
We have. We've had little outbreaks of measles and pertussis and things like that. And, these are diseases that once were common and then became uncommon. But if we don't vaccinate them, the problem ends up being that we have little outbreaks of those, and then they can become bigger outbreaks. So,
yes. Especially with measles. It's one of the most contagious viruses we know of. Thank you. So, Dr. Sacheti, thank you so much for joining us today.
Thank you for having me. It was nice to see you.
Good to see you again. Always good information. You're right. It's just Symphony. It's one of those things that you forget about it because they go away. Like with polio, go talk to people of a certain age. My goodness, the terror parents had over polio. We more or less eradicated it, but now you start to see some pockets here and there when those vaccination rates drop.
Something to keep up with for sure.